When doing an initial consult where you're going to be doing testing and diagnosis, my screen organization is a little bit different. I will open the acquire page as I normally do, and it will go to the position that you last saved it at. And then I'll go up and I will load the image organizer just like I do during a normal treatment case. And the image organizer goes to its usual position. But since you're doing an initial consult and some multi-tooth testing, the screen organization that I use is slightly different. So the first thing that I'll do is I'll go and load the diagnosis page. And when the diagnosis page comes up, then I will go ahead and load the multi-tooth info form. And that comes up ahead of on top of the acquire form. So during a consult, sometimes you're taking additional x-rays, so you want the acquire form up, but you really want the diagnosis page up and the multi-tooth info form up at the same time. And I also want to see the pain summary that the patient has filled out so that that's on the screen too. And you just position that where it's convenient to see it. So now you really have everything that you need when you're doing a diagnosis and a testing procedure. Sometimes I'll have my notes up because sometimes there's things in the notes. So I position that towards the side, and I can review any notes that maybe the doctor has put in or the front office has put in. So this is the basic organization of the screen for a consult or a diagnosis. Sometimes I'll bring up the x-ray pop-up if I just want the x-ray uh, up in front while I'm actually doing the testing. I'll enter my select notes at the same time. This allows me to put the notes in that I want on the multi-tooth testing form. I use select notes. I've created some very specialized notes for testing, and I'll go ahead and enter those into the record while I'm actually doing the testing. So this is a pretty efficient way to do a consult where you're doing testing and radiographic and clinical examination, and you can have all those screens up all at once without having to do a lot of clicking.